Good evening, everyone. I'm Jennifer McCreath from St. John's Pride. Tonight we are having a panel discussion on healthcare issues that affect members of the LGBTQ community. I'd like to thank Rogers Television for being here. Without further ado, I'd like to introduce our first speaker from the AIDS Committee of Newfoundland and Labrador, Mr. John Baker.
I tested positive for HIV in 1993, 5 years after I came out as a gay man. Some of the issues at that time in my life that created the conditions that made it possible for me to get infected with HIV had a lot to do with the coming out process and how difficult it can be, trying to find support. Friendship, those kind of things is not easy when you feel very alone and you're trying to find your way in the beginning of your coming out process. At the same time, I was very new and green to the situation. I did know about HIV and AIDS, and I was fairly well informed. Circumstances happened in my life, such things as alcohol and drug abuse, violent relationships, things like that, were precursors for me to make very poor decisions and ultimately engage in unprotected sex. Unfortunately, I was infected with HIV. I found out at the age of 25. At that time, my doctor told me, I don't know where you'll be a year from now, and I doubt if you'll live to see the age of 30. So armed with that knowledge, I just went out and continued my destructive habits because I figured I'm going to be dead soon enough. As the years passed, I didn't die. 1996 came. They came out with the AIDS cocktail drugs, which turned the face of AIDS around for many of us. For the first time, they actually had some life-saving drugs. I started taking them. It wasn't a very pleasant ride at all. The drugs were very toxic and very awful side effects. Anyway, fast forward, I stuck with it. In 2006, the position of outreach coordinator became available at the AIDS Committee of Newfoundland and Labrador, and I said, aha, this is a great opportunity for me to put a face to HIV and go out in my job and talk to young people, community groups, anyone who will listen about HIV and AIDS, what it is, and how you protect yourselves. So I get a lot of satisfaction out of my job. But I kind of get a little bit frustrated sometimes, especially when I look at the LGBTG community. This is my opinion, but I get the impression at times that young gay people do not want to be associated with HIV, and they almost find it offensive to be put in the same arena as that. But as was stated earlier, 44% of new infections in Canada are men who have sex with men. And because of that fact, I think it's very important to keep HIV and AIDS right there on the radar so we can all be aware and protect ourselves. When you're young, especially for me, when I was a young gay male coming out of my closet, experimenting and trying to find my way, I made a few mistakes, unfortunately, and I've seen others go through the same kind of ordeal I did. Not necessarily get themselves infected, but just have a hard time with that whole finding themselves and what out means to them. There's new prevention strategies. One is called PEP, pre-exposure prophylaxis, PEP, post-exposure prophylaxis. Let's say you had a needle stick injury, you're a hospital healthcare worker, you take drugs after you had a needle stick injury, and that will prevent infection with HIV. The latest data and research shows now that there's a thing called PrEP, which is pre-exposure prophylaxis, which basically means a person who doesn't have HIV will take HIV medications at the same time every day, and at least among heterosexual couples, the data shows that there's an over 90% reduction in the transmission of HIV. So as these new technologies come on stream, we won't have to depend quite so much on condoms. As we know, not everybody wears condoms, and it ultimately causes the increased spread of HIV and AIDS. Good, effective prevention work with young gay men has the same basic elements as prevention work with any group or community. It involves raising awareness about HIV and AIDS, challenging myths and assumptions, and reducing stigma by providing people with accurate, up-to-date information and opportunities to clarify their attitudes and values. It involves providing opportunities for people to develop their personal and social skills in order to enable and empower them to make decisions and carry them through in terms of protecting and promoting their sexual health. And it involves providing accessible and appropriate sexual health services and advice, including areas access to condoms. I personally think that more education needs to go to healthcare professionals, frontline workers, doctors, nurses, about LGBT health issues, about HIV and AIDS, and how all this is integrated. I work at the AIDS Committee of Newfoundland and Labrador. We're in a building called the Tommy Sexton Center. And in our building, you'll find the AIDS Committee offices, as well as housing for people living with HIV and AIDS, designed to get them out of a bad living environment, perhaps a moldy basement apartment, into safe, affordable housing, where they can work on whatever issues they might have, be it adhering to their HIV medications, or substance abuse problems, or mental health issues, whatever it might be. We also have a needle exchange program called SWAP, Safe Works Access Program, and people who inject drugs can come in, discard of their used equipment and get new equipment, and this way people will not be sharing needles and won't be spreading infections. We also have a short-term shelter which is open to anybody between 16 and 64. This is designed to help people who are homeless. Anybody who's considered homeless is also considered high risk for HIV, because if you don't have a bed to lie down every night, nothing else seems to fall into place for people. We are in the process of planning an event for next year's World AIDS Day, which happens on December 1st, and it's a collaboration between the AIDS Committee of Newfoundland and Labrador, the HIV clinic team, and Eastern Health, and it's basically going to be a conference on World AIDS Day, inviting healthcare professionals, frontline workers, doctors and nurses to get educated more about HIV and AIDS, and hopefully that's one step that will help bridge the gap between some level of ignorance, perhaps we'll call it, with healthcare providers and clients. Thank you for the opportunity to be able to speak, and my main point out of all this is to keep HIV and AIDS in the focus of the LGBT community so that they are aware, they can protect themselves, and not have to endure living with HIV. Thank you.
Thank you very much, Mr. Baker. And I'd also like to thank you for hosting the Open House Pride event, which we had the other day, which was very successful. So let's give them another hand for that. Without further ado, I'd like to introduce our next